So yes, I disappeared for a while. No, I didn't quit and I didn't suddenly become a millionaire. I wish I had become a millionaire though. Life has just been lifing lately. Between everything that's going on right now, career stress, and planning my next move as a nurse, juggling businesses and family responsibility together, honestly, I'm just trying to keep my sanity in this current chaos that's going on right now. So I had to take a step back because it's been a lot. But here's the thing, no, I didn't quit, I just paused. And during that pause, have been trying to re-strategize my nursing journey. Have been trying to figure out this whole relocation process, especially with all this restriction and visa ban that's going on now, because this is not for the weak at all. So if you've been wondering where I've been or where I went, don't worry, I'm back. And this time we're talking real life, nursing struggle, relocation reality. There's no sugarcoating here. And what you can do in the meantime with what's happening right now, with all this restriction, with the pause on immigration, the war that's going on right now, healthcare crisis, hantavirus, and have you heard? They said Ebola is back. So it won't be our portion in Jesus' name. So the truth is, everyone is impacted by what's going on right now, especially with the Iran war. So if you've been living under a rock, even rock they shake at this time. So we are going to talk about a lot of things. We're going to talk about money, investing, lifestyle, warning signs of disease conditions, nothing wins and nothing mistakes, and basically everything that nobody tell you. And most importantly, we're going to have a segment on nursing tea, what goes on among nurses, what goes on among interdisciplinary staff, and the stereotype that's attached to nursing. How this stereotype has impacted your life. I mean, especially for those of us in diaspora. How has this stereotype impacted your family, your relationship, and community as a whole, and so on. So, if you're still here, I do appreciate you more than you ever know. And if you're new, welcome back to the channel. You're back, you came at the right time. So, welcome back to the Over Sabi Nurse channel. Now, let's talk about the doctors. Have you heard that the United States government has just lifted the visa restriction on foreign doctors in 39 countries, and Nigeria is one of them? So the reason is because the US hospitals foresee worsening physician shortages. There are so many rural areas and underserved communities that depend heavily on international medical graduates. Hundreds of foreign workers that are already in the United States are at risk of being forced to leave the country because of the processing delays in their visas and the added restrictions with this current administration. So therefore, this policy reversal doesn't really mean that all immigration restrictions have disappeared completely, and it doesn't mean that doctors can just come to the United States automatically, and it doesn't mean that all travel bans have ended. So doctors are still subject to the usual screening. They're still subject to enhanced background checks, biometric screening, and the standard visa eligibility that is allowed in the United States. So this visa ban that is lifted, it simply means that applications for medical professionals will continue to be processed as usual as it used to be. Applications like work authorization and other visa access is being restored so their application can continue. So this brings me to call on African nurses. African nurses, where are you? So if this can happen to the doctors, nurses, brace yourself, because doctor shortages is nothing compared to nurses shortages. And you know why? Because nurses have a larger workforce in healthcare. Which side are you going to be when this happens to nurses? Because we're talking about doctors now that the visa ban has been lifted. When the time comes for nurses to start coming, to the Western world or to come to America, where are you going to be? Because if this can happen to the doctors, nurses, you're going to be next. This can also happen to nurses. When visa categories open up for nurses or start to move faster, hospitals and international recruiters usually prioritize candidates that are already licensed who already have their credentials and documents ready. So which side are you going to be when that time comes? Are you going to move with the opportunity, or you're going to get left behind? So this is how you can position yourself to make sure that you take advantage of that opportunity. You can start building your finances right now, because it requires a lot of money. Update your passport, renew your passport if you know it's almost expired. Pass your IELT or TOEFL, get your certifications that you need, and start preparing your credential evaluation. You can also start the processing of your visa screening. And if you know you need to pass your exam like CBT or NCLEX, start preparing for it now. Do your registration. Start developing your skills and sharpen your digital and interview skills. Also, you can start to build relationship with reputable recruiters abroad. So in that way, they already know you, they know you are interested. So even when they're talking amongst themselves, they can be like, oh, I have a nurse that's in Asia, in Korea, in China, in Nigeria, in Kenya. I have this particular nurse. She's really interested, and she already get herself ready. Make sure your license is active in your home country and you are up to date with the Nursing and Midwifery Council. Pay their fees and any certification or registration that you have to do with them. Also, get your hospital experiences at this time. Use this time to build yourself and be intentional. So there you have it. So those are the tips that you can use now, or things you can start preparing now during this visa ban, so that when that time comes and is lifted for nurses, today is the doctors, though, tomorrow it might be for the nurses. So share this with that one nurse that you know has been procrastinating and wish to travel abroad to continue our own nursing journey. So like the video, subscribe to our channel if you haven't. Until next time, remain blessed.